That's right, Steve. I was able to connect with some key doctors here at Wake Med with the Health and Human Services. They've really been sounding the alarm about the rising cases of syphilis in our state since 2018. Now babies are dying from a preventable disease that requires screenings to catch. But a failure to screen is a violation of our state public health laws.
Just last month, we said we had a little syphilis ward.
Neonatologist Dr. Claudia Cadet is on the front lines at Wake Med, fighting for and caring for sick newborns. And the sickness lately, syphilis.
We had a handful being treated at the same time, like more than 3 at the same time.
Babies born with syphilis, a bacteria contracted from their mothers. Already this year, North Carolina has seen 5 stillbirths and neonatal deaths due to congenital syphilis.
I think it's frustrating to all of us. I think none of us wants these outcomes.
The trend is similar to what the CDC reports nationally. The agency reporting more than 3,700 babies were born with syphilis last year. 10 years ago, that number was just over 330. In the health alert sent to doctors earlier this month, the North Carolina Department of Health and Human Services identifies several missed opportunities to prevent infections. In a review of the 2022 congenital syphilis cases, 53% of mothers or babies born with syphilis had little to no prenatal care.
I almost want to say if you were to poll those 53%, did they have access to equitable care?
Dr. Brian Shackelford says he's seeing more cases of syphilis this year than in the last 6 years of his practice. 2 cases just this week. Access to care is one issue, but Shackelford believes inadequate treatment of the mother's infection is problematic.
A lot of times, even with screening, you hear about gonorrhea, chlamydia, HIV. You really haven't heard the kind of thrust to get syphilis testing.
The state is urging clinicians to screen pregnant women 3 times during their pregnancy because data reveals 86% of syphilis infections reported in pregnant women in the state were asymptomatic at the time they were diagnosed.
If you're not getting your maternal care, some of those latter testings and screenings can be missed.
So the key here is screening, advocating for yourself as an expecting mother and your unborn child. The state is rolling out a campaign to increase testing. They're also making rapid tests available to test for syphilis. In Raleigh, Janice Price, ABC 11 Eyewitness News.
Yeah, so preventable, as you point out. Screening the mothers can keep the babies safe. We'll hope for a reversal in those trends. Janice, thank you.